If you have a concern and you have a new foot drop, which is a weakness in your ability to pick your foot up or to push your foot outward, that is a foot drop. That is never normal. If you have a sudden onset of a foot drop, it is always appropriate to see a physician. Usually one would start with their primary care physician because theoretically you have a shorter time period to get into that individual and they know you. And then that primary care physician can then farm you out to the appropriate physicians that they think are appropriate. That may be a neurosurgeon. It could be a pain management spine team. It may be a peripheral nerve surgeon. It might even be an orthopedic surgeon sometimes. Is it coming from your spine? Do you have a herniated disc? Most patients would have terrible pain in the back after that, and that would be appropriate to see a spine team or a pain management team or a spine surgeon first so they can work things up. For instance, you wake up from an orthopedic surgery, you have your knee replaced, or your hip replaced, or you fell down a flight of stairs and broke your leg, and you have not only your fresh post-op wound or your brand new broken leg, but now you can't lift your foot up or move your foot outward, and it's numb to the top of your foot and may be very painful to the top of your foot. You may have had a gallbladder taken out and you woke up with a foot drop. You would take that to your general surgeon who did the gallbladder. You do it right away so they know what's happening. They may do an MRI of your pelvis. MRIs tend to be a little bit more sensitive, so they tend to show soft tissue better and nerves better than CT scan. They may order an EMG or nerve conduction study. That's where the neurologist or another subspecialty of physical medicine and rehabilitation may put a little electrical probes on you and shock you with electricity to see if they can measure the function of the nerve. Don't worry if you can't get one of those in the first week or two. That's not normal. You won't even see anything. It's not abnormal yet, typically. It takes time for that to become abnormal to be able to read it. Physical examination, which is why it's important to get in early to see your physicians.